Sebokeng, the largest township in the Vaal Triangle. By car about an hour south of Johannesburg. It's an area that's literally bursting at the seams, from suburban homes to informal settlements.
The burden of diseases have increased. Trauma, violence, HIV, hypertension. We are seeing a lot of premature babies. As a result, we are full all the time.
Dr. Zulela Nkwabe, CEO of Sebokeng Hospital, is only too familiar with the strains of struggling to serve the over 1 million people who come from not just the surrounding townships, but the Free State, Lesotho and even Zimbabwe. The hospital's medical facilities are stretched to the limit. Despite these demands, 6-month-old Tabasang is getting the high care treatment he would get in any of the country's best private clinics. But a few months ago, little Tabasang could have been in no man's land. And this is because Carte Blanche Making a Difference Trust has built a brand new infant high care ward offering emergency critical care for babies over 28 days. Previously, these little patients were farmed out wherever there was a bed, be it Baragwanath Hospital or an adult ward at Sebokeng.
It's very comforting for me as a specialist to know that, when a child comes in and they're in trouble, at least I have something to offer them.
No one is more delighted with this new unit than Chief Pediatrician Dr. Tapelo Teletsani. Why do you have to make this very distinct separation at 28 days?
Babies that are born from birth until 28 days, we refer to those as neonates. And obviously they have their separate unit. We would discharge these kids, and when they come back sick, it's difficult to admit them back into the unit because of the germs that they have acquired at home.
Are you saying there can be complications if a baby goes out into the community and then returns to a ward, to a unit? There are dangers.
Definitely there are dangers.
In this community, around 35% of the babies are malnourished, which leads to a high incidence of pneumonia. This high care unit can not only save these babies' lives, but often avert the need for them to go to an ICU.
I feel satisfied, humbled.
Dr. Nkwabe believes the new high-tech equipment of the ward will help address our growing nursing shortage, also evident at Sebokeng.
Actually, there are monitoring screens.
Okay.
We've got patient 1 here, which is that patient.
Okay.
So a sister can actually sit here and actually use the monitors. They can actually pick up before a complication. Instead of having a lot of resources, we have actually put everything within here, and we can manage and see where danger is. And I think that is the way to go moving forward. Just looking at the opening, emotions were running high. I couldn't believe that is actually happening. Sometimes we all sit, we all plan, but when we were saying that, yes, it is here, I couldn't believe it. I couldn't believe it. I was very grateful for the hospital to help us fulfill the dream that we always wanted.
This high care unit was made possible by a donation of almost 5 million rand from Mining House South 32.
If you look at the budget, our donation here, it's not huge, but the impact is huge. That is what has actually convinced us, and we just try day by day to make a difference from the ground up.
The Carte Blanche Making a Difference Trust is 8 years old and has raised over 120 million rand. Building and improving children's hospital wards, ICUs, and emergency care facilities around South Africa.
The way the trust actually does it, they go to the patients, they go to the staff, and they ask them, how do we create a friendly place?
Patron of the trust, Carolina Andropoulos, is committed to improving our pediatric facilities. It was the passing of her daughter Georgina from a rare form of cancer that inspired the creation of the trust. Sponsoring the first public high care infant unit in the Sedibeng district was a no-brainer for South 32's operations manager, Garth Lafleur.
I personally have been involved with this community for more than 20 years now. We are deeply committed to our communities here in the Sedibeng area. We have deep roots in this area as a company. We wanted to give back.
This is about improving the quality of life, and it starts with the babies. And hospitals are those areas in our community that should give hope.
Like 2-month-old baby Mpho, who had severe bronchial pneumonia. Mpho was discharged 2 weeks ago, much to the relief of his mother, Nomathemba. Nomathemba, how's little Mpho doing now?
Alright, since it's best alright.
Says the child is much better since they came back from hospital.
It was touch and go for Mpho's first 2 days in the high care ward. Were there times when you thought you might lose your little baby? You thought he might not make it? This new unit, along with its sophisticated equipment, has actually set Sebokeng on a new path. A link with Chris Hani Baragwanath Academic Hospital that will benefit specialists in training along with their little patients.
I'm quite excited that starting next year, there has been registrars that are going to be starting with us here. And not only that, there's also been talk about involving the student interns for them to come and rotate here, because this area, as it is, it has a lot of pathology that can actually teach lots and lots to the students as well.
So what we're talking about is these young patients getting very professional medical care.
I mean, with the registrars coming along, that is going to improve the system in many ways. One, it also addresses the issue that has to do with staff shortages. It will keep us on our toes in that we always have to be keeping in touch with what's happening in the world out there to be able to pass on the knowledge to the registrars as they rotate with us here.
In these tight financial times, money is often hard to come by. Donations not easily given. Sakiwo Health Solutions once again partnered with the Trust to develop the unit. Polyfloor have donated the flooring on all the campaign's hospitals, and this is the 3rd time South 32 have sponsored a project. Garth, why has South 32 continued to support the Carte Blanche Making a Difference Trust?
A very high percentage of the money that we contribute actually finds its way into actual equipment, into actual refurbishment. It's not being, filtered off someplace else. With that, we trust where the money is being used. We like the governance. We like that there's follow-up to ensure that the units are working. There's no use investing money like this if it's not going to be effective and useful for the communities.